materialist doctrine. So I studied medicine, I became a psychiatrist, and very, very soon I got into deep conflict about psychoanalysis, which was the reason why I studied psychiatry. And this was the conflict between the theory and practice of psychoanalysis. I was increasingly excited about the theory, into how many areas psychoanalysts have penetrated and given seemingly brilliant interpretations for all kinds of things. Symbolism of dreams, symptomatology of neurosis, psychopathology of everyday life, religion, content of art, socio-political movements, and so on. So that was very exciting, but then I also became aware of what you can do with psychoanalysis as a practical clinical tool, and that was a whole other story. It was a very narrow indication range. You had to meet very special criteria. And then particularly there was the enormous amount of time, energy, money. My own analysis was over 7 years, 3 times a week, with tremendous commitment. And I had difficulties understanding that. I had a very Freudian, orthodox Freudian analyst who used to say psychoanalysis is the science of the human mind. There's nothing psychoanalysis cannot explain in that department. There are only things that it hasn't explained yet, because there were not the right subjects for the free associations on the couch. And you had to study medicine to become an analyst. And in medicine, if you really understand the problem, you usually can do something fairly dramatic about it. Or if it's an incurable disease, you have a pretty good understanding why you cannot. But here the idea was that we have complete understanding, and yet we can do so little over such a long period of time. So I became very disappointed. I started kind of nostalgically thinking back about the animated movies. I should have never chosen this discipline. And then something very powerful happened in my life. This was the time when there was excitement about psychopharmacology, the early tranquilizers, antidepressants. And we just finished a large study of malarial, which came from Sandoz Pharmaceutical Company. So we had a good working relationship. And as you know, if you have a good relationship with pharmaceutical companies, you get a lot of fringe benefits. So they send you free literature. They might pay your trip to a conference when you report about their preparation. And they also send you a lot of other preparations, that they develop. So as part of this cooperation, we got a big box of ampules, and there was an insert that came with it. It said this was LSD-25, very interesting investigational substance discovered in the laboratories of Sandoz practically by accident by Dr. Hoffman. It was supposed to be a drug for relief of migraine headache and stopping gynecological bleeding, and sort of fell a little far from the tree. Dr. Hoffman intoxicated himself accidentally when he synthesized this sample. We found out it had a very powerful psychoactive effect. They reported this, gave it to Dr. Stoll, who was the son of Dr. Hoffman's boss, the psychiatrist in Zurich. And Dr. Stoll, in 1947, published the first scientific paper on LSD in a group of so-called normal volunteers and psychiatric patients. This became a sensation overnight, and Sandoz now was sending samples to different research institutes, to universities, and also to individual therapists. And they were basically asking, would you work with the substance and let us know if there was any legitimate use for LSD. And in the letter, they suggested 2 possibilities. One was, we have a feeling on the basis of the pilot study that this drug produces in minuscule dosages of millions of a gram a state that's very similar to naturally occurring psychosis. So it's possible that psychiatrists, psychologists would have a model here. You could give it to normal people, do all kinds of testing before, during, and after, get some insight about what's happening in the body when these changes in the mind are occurring. And it could turn out that schizophrenia and other psychosis would really be chemical problems. They would not be psychiatric problems at all. The excitement about LSD was not the effect, because there was already knowledge of the psychedelic effects of mescaline. Mescaline was studied in the 30s. But the excitement was about the minuscule dosage, because it was conceivable that the human body could produce, under certain circumstances, small quantities of a similar substance and be responsible for psychotic phenomena. And the idea was, if we can identify the substance, we can find some neutralizing agent, and there would be a test tube kind of a solution. Then there was a second point which became something that changed my life, and that was a little note that said, we also feel that maybe this substance could be used as a kind of unconventional training tool for psychiatrists and psychologists and students and nurses. Professionals would have the opportunity to spend a few hours in the world of their patients, and as a result of it, be able to communicate with them better, to understand them better, and hopefully to be more effective in their treatment. So this was an opportunity I wouldn't have missed for anything in the world. I became one of the early volunteers. And my preceptor, who got the substance from Sandoz, at the time was interested in EEG, and he was also interested at the time in what's called driving the brain waves, exposing people to different acoustic and optical frequencies and studying in the corresponding areas of the brain if entrainment happens, if the brain waves will pick up the frequency that is being fed. So those of us who wanted the LSD experience had to agree to have not only the EEG done, but also our brain waves driven, sort of before, during, and after.